Dr. Caleb Bupp. I'm one of the genetics physicians here at Spectrum Health and Helen DeVos Children's Hospital. I'm also the division chief here. And I have the opportunity of seeing a lot of patients who have genetic conditions and a lot of patients who have rare diseases. And what we do in our clinic here is, we see patients and we talk about genetic information and talk about genetic concepts. And then we're often able to participate in genetic testing for our patients and look, with a blood sample or even with something as simple as a cheek swab to get a DNA sample and then go looking to see if we find something in the genes, the chromosomes that gives us an explanation. And what we get back is often just a piece of paper that lays out what changes may or may not be found. And then we look at that and try to understand what that means. So what got me interested in rare disease? I got interested in rare disease and rare disease research when I was in medical school. I worked with the Alzheimer's Association in the city that I was in and learned more about that condition and the impact that it had on caregivers, and did some advocacy as well, and just started to get a better appreciation for a specific condition. And then as I went on with my training and became more focused on genetics, I would see patients that had specific genetic conditions, let alone very rare conditions. And the question started to come of, well, how do we understand these better? So what my research focuses on is trying to answer questions that patients have about what diagnosis they may or may not have, and then what that diagnosis means. And the other thing that I'm interested in is trying to speed things up as much as possible, to find things as soon as we possibly can to get the maximum impact out of it. Patients and families should know that the research that I am involved in is very patient-focused. Every patient is unique, and even in a rare disease, no two patients are the same. And what we try to do is understand the differences as best we can to help people in the life that they're living get the most out of it and have the most questions answered. And that's not always possible, and sometimes we have to leave questions unanswered. But it's what I think the reality is for a lot of patients and families, is doing the best with what we have, bringing around a medical team that can help as best as possible, and then continuing to push forward as time goes on. So students and those who are thinking about rare disease as a part of their career should know that it really takes collaboration to get things done. No one person can do anything by themselves, and you never know who you'll meet along the journey. And making friends and making partners really helps take what you can do and what someone else can do and add them together to become so much more. And that's really been my experience as a clinical researcher, is to find folks that are involved in things that I don't have experience or expertise in, and really work together to advance things forward. I think it's also good as a student to be willing to ask questions. Don't assume that what somebody's talking about. Ask those clarifying questions, and then be thoughtful and follow up. Always make sure to sort of close the loop, because a little bit of effort goes a long way when it comes to advancing research.